And look at the pulmonary medicine topics. Pneumonia is such an important topic. This includes TB and HIV as well. And ILD is a very important topic. Obstructive sleep apnea has been asked so many times, especially the indications for CPAP. And the basic principles in pulmonary medicine has been tested a lot. And the CT principles are also very, very important. What are the important CT images that you need to decide? Hey everyone, welcome back. This is Dr. Dilip, your internal medicine educator at PrepLadder NEET SS. Here am I to discuss about the most important topics that you need to know before attempting your NEET SS exam. I've compiled this stuff based on the question papers of INA CET and NEET PG for the last 3 to 4 years. And most of my lecture are going to start with this slide, that change is the only constant which never changes. Accordingly, you're going to have a lot of changes in the NEET SS exam because the pattern has changed. And it's not the strongest of species that survives, nor the most intelligent that survives. It's the one that is most adaptable to change. So whether you're going to adapt to it or not is up to you. If you're going to adapt, you're going to succeed. And these are things that you already know. The paper is going to be at a PG exit level. You're going to have 150 questions, 2.5 hours. So you're going to have 1 minute per question approximately. Correct response is going to carry +4. Incorrect response a negative of 1. If you don't mark it, you're going to get a score of 0 for that. And what are the most important topics? Let's come back to that. When it comes to cardiovascular medicine, the cardiomyopathy part is very, very important, especially the hypertrophic cardiomyopathy and ARVC, that is arrhythmogenic right ventricular cardiomyopathy, is a very important topic for exams. And the sudden cardiac death component of HCM and ARVC are also going to be extremely important. What are the indications for implantable cardioverter defibrillator? These are the areas that you need to concentrate. When it comes to pericardial disorder, the constrictive pericarditis part and the cardiac tamponade part is extremely important. When it comes to acute coronary syndrome, the recent trends in the management of ACS is very important. And the evaluation of chest pain in non-emergent setting is also very important, especially when it comes to the radionuclide scans and the importance of cardiac CT angiography. When it comes to clinical cardiology, few areas like the murmurs and your JVP and your pulse also becomes extremely important. And the basic echocardiogram is very important, including assessment of vascular dysfunction, TAPC and its importance, and related stuff. When it comes to valvular heart disease, the treatment is very important, especially what are the indications for surgery and when you're going to manage medically. And hypertension and diabetes, needless to say, are very, very important topics. When it comes to hypertension, they might ask you the management algorithm for hypertension based on the ACC-AHA protocol, and they might ask about the drug effects and what are the adverse drug reactions that you're going to expect in the setting of treating hypertension. And coming to neurology, we all know that stroke is such an important topic. No paper is going to contain a question that's not going to ask on stroke. So definitely going to get a stroke question. And the related interventions are very important because we had a lot of advances with regards to ischemic stroke management in the last 1 to 2 decades. So that's why the intervention part, including the carotid artery intervention, is going to be extremely important. Epilepsy is another very important topic, especially status epilepticus, and especially the childhood epilepsy and syndromes have been repeatedly asked. And when it comes to movement disorders, the treatment of Parkinson's disease, the algorithm is extremely important and crucial. And apart from that, the diagnosis of movement disorders itself is a very important topic. Myasthenia and its treatment is important. And various muscular dystrophies and its diagnosis can be asked in exams. And demulting disorders are another very, very important topic. Like they might ask about NMO spectrum disorders. This is one of the very important areas of interest for the examiners. So don't miss out on the demulting disorders, especially of the CNS as well as of the peripheral nerve system like GBS. And look at the pulmonary medicine topics. Pneumonia is such an important topic. This includes TB and HIV as well. And ILD is a very important topic. Obstructive sleep apnea has been asked so many times, especially the indications for CPAP. And the basic principles in pulmonary medicine has been tested a lot. And the CT principles are also very, very important. What are the important CT images that you need to decide? And the vascular disorders, especially pulmonary embolism and venous thromboembolism, are going to be extremely important as well. When it comes to endocrine section, the obesity part is a very, very common target in your exams, and the energy metabolism, including the basic physiology, something that's extremely important, that's given in Harrison. And the entire adrenal and its physiology and pathology is extremely important. Diabetes, Needless to say, it's such an important topic, and the recent ADA guidelines should be in fingertips. And posterior pituitary. Usually don't get that much question on antipituitary though, but the posterior pituitary and its problems are going to be extremely important. This includes the sodium disorders as well, and the parathyroid and the calcium disorders, especially the congenital calcium problems, are going to be extremely important for exams. What about hematology? The hemoglobin disorders are extremely important, including thalassemias, sickle cell disease, hereditary spherocytosis, pyruvate kinase deficiency, and so on. And your hemolytic anemias, especially autoimmune hemolytic anemias and paroxysmal nocturnal hemoglobinuria, are going to be very important for exams. Bone marrow failure is another very, very important topic, especially the treatment of aplastic anemia is something that they may ask. Transfusion medicine, especially the transfusion reactions, are a common target. And again, hypercoagulability is such an important area. They might ask about factor V Leiden mutation and how to treat an inherited thrombophilia. And what are the indications for lifelong anticoagulation? These are some of the questions that you may get. And coming to gastroenterology and hepatology, we know that IBD and malabsorption are going to be important in any exam for that matters. When it comes to IBD, they're not going to ask the pathology that much. They're going to ask about the treatment predominantly. And esophageal manometry, diagnose motility disorders, is very important. And the Chicago classification, don't forget that. The treatment of viral hepatitis and serology of viral hepatitis is very important as well. And finally, a lot of questions in the recent past are focusing on the drug-induced liver injury. That's the DILI part as well. And coming to nephrology, the acid-base electrolytes is important for any exam. So that's something that's a no-brainer. Dialysis, you should know at least at a basic level. Transplant is extremely important, especially the infections post-transplant is something they will definitely ask. And of course, to some extent, you can get questions on rejection as well, especially acute rejection and its management. Cystic kidney disorders are very important. You can see plenty of questions in autosomal dominant polycystic kidney disease and medullary sponge kidney in the recent past. So don't miss out on the cystic kidney disease. And in the last 2 years, there have been plenty of questions on the tubulointerstitial disorders as well. Coming to rheumatology, the evaluation of arthritis and the treatment of various important arthritis like rheumatoid arthritis is extremely important, especially the biological part is very important. And SLE and its treatment options, especially in the recent past, there have been various targeted therapies for SLE. Those have been asked in the exams as well. And the pregnancy and its impact on rheumatological and cardiac disease, both are extremely important. When it comes to vasculitis, the small vessel vasculitis part is extremely important for exams, even though you can get questions on large and medium vessel vasculitis also, but if you want to concentrate on one area, you have to concentrate on the small vessel vasculitis part. And amyloidosis, again, that's a very, very important topic because, again, there have been many new drugs that have been approved for amyloidosis in the recent past. That's why it's important. And coming to oncology, most of the questions are going to cluster around your basic cancer biology. Many students tend to miss out on that. And they try to prepare extensively on a lot of cancers, but most of the questions are going to cluster on your basic cancer biology only. And all the hematological cancers, including myelodysplastic syndrome, is very important because people generally miss out on MDS part. And the next important cancer will be colon cancer and hepatocellular cancer. And the imaging methods to assess your various solid lesions in your liver is extremely important for exams. And the breast and the lung cancer will be the next most important. And finally, you can remember about thyroid cancer and carcinoma of unknown primary as well, or cancer of unknown primary. And coming to infectious diseases, HIV, of course, is an evergreen topic, very important for exams. TB is such an important topic, especially at the SS level, they'll be targeting your MDR and XDR TB regimes, and especially the adverse drug reactions of antitubercular drugs are also very, very important. And as such, it's not only about the TB drugs. Adverse drug reactions of any antimicrobials and the interactions with other drugs are the target for your examiners, and all the tropical infections should be at your fingertips, including COVID as of now. And fungal infections, especially with regards to Candida and Aspergillus, is very important for exams. And in the recent papers, you're seeing a lot of questions on febrile neutropenia as well. And coming to critical care, the final topic, you need to be aware of the basic ventilator strategies at least. And toxicology part is very crucial. And there have been some questions in the recent past on critical care myoneuropathy as well. And of course, you need to know about the general treatment of severe sepsis and septic shock. It's not only about the septic shock, you need to know about how to classify different types of shock and of course, the deeper levels of treatment of every single type of shock are also extremely important. And arrhythmias are important, but most importantly, in the recent past, they have been asking a lot of questions on electrical storm and how to manage it. And these are the important topics. And I don't want to waste a lot of time because I know you are in a crunch situation right now. You cannot afford to see a video of 30 minutes or 40 minutes. And I will finish up the video, and all the very best. I'd like to say one thing before signing off. There is only one thing that makes a dream impossible to achieve. That is the fear of failure. Don't have the fear of failure. Attempt the exam very, very confidently, and you're going to be successful for sure. My best wishes and all the very best.
Subscribe and press the bell icon so you never miss an update from PrepLadder.